Good day, this is Philip Peart. I'm a student at TCAT Nashville. Today's date is November 5th, 2016. The time is approximately 16:30. I will be explaining the procedures for clean catch urine specimen, sputum specimen, and stool specimen. Before each of these procedures, I will perform 5 universal steps. First being to identify myself to the patient. I will then have the patient verify his or her name and date of birth. Those are 2 identifiers. I will then explain the procedure to the patient. I will then provide privacy, and I will use proper hand washing techniques, and I can don gloves if necessary. The first procedure will be the clean catch urine specimen. I will first gather my supplies. That will be the specimen cup and cleansing wipes. I will then open the lid, the specimen cup, using a sterile procedure, making sure not to put my finger inside of the cup or inside the lid. I will then explain to a female a patient to sit on the toilet, then to spread her labia, exposing the urinary meatus. I'll then have her cleanse the outer labias, and then clean down the middle last. Each wipe, it will be a separate cleansing pad. This will be 3. I would then explain or have the female patient, while still holding open the labia, to begin the urine stream, and midway through the stream have the patient then urinate into the specimen cup. Once the specimen has reached a level that's needed, the patient can then remove the cup and continue to void, bleeding her urine into the toilet. From here, I will then close the cup using a sterile technique again, making sure not to put my finger inside of the lid or the container itself. Close that lid, and I will then label and send the specimen where it needs to be sent to. Also, for a male patient, when cleaning, I will need to also use 3 cleansing pads, cleaning in a circular motion, or first to pull back the foreskin if there's foreskin, and clean in a circular motion using 3 separate times using the cleansing pads, and then explain the procedure similar to the female's procedure, which is to begin the urine stream, and midway through the stream, then pee into the cup, or urinate into the cup, and until it reaches the where it's needed, the line. From there, the patient will then complete the urine process, and then from there the container will be closed using a sterile technique without putting your fingers inside the container or the lid, and that will be properly labeled and sent to where it needs to be sent. The third procedure will be the sputum collection. Again, I will gather my materials, the specimen cup. I will open the specimen cup using a sterile procedure, making sure not to place my fingers in the cup or the lid. I will then explain to the patient that the specimen will be from the lungs, and I will then have them take 3 deep breaths, and then to cough very deeply, releasing the sputum into the specimen cup. I will then replace the lid using a sterile procedure, making sure not to place my fingers inside of the specimen cup or the lid, and I will then help the patient get comfortable and label the specimen and send it to the labs. The final specimen will be stool specimen. I will gather my material. I will then explain to the patient on the correct way to use the hat. I'll also inform the patient that they are not to void or use or place paper into the hat. I would then have the patient inform the patient to notify me once the specimen is available, and provide privacy for the patient. Once they're done, they'll contact me. I will then don gloves, and from there I will inspect the stool for its color, its consistency, for the odor, and I'll also check for mucus and blood. From there I will get a tongue blade, and I will take a sample of the specimen, and before this I'll have the specimen cup available, and with that also using a sterile technique to open it to make sure I don't put my fingers inside the cup or the lid. Place the specimen inside the cup, close the lid. If the specimen will be checked for ova or parasites, it needs to go to the lab immediately. And thank you. Bye-bye.